Hey there, Sterile Processing Universe. I'm Brandon from Beyond Clean, and I want to welcome you to the Beyond Clean Mailbag Series video, where you put us on the spot with your questions. If you've got a question that you want us to answer, there's a few ways you can send it our way. You can send us a message to Facebook or Instagram using the handle @BeyondCleanPodcast. Or you can send us an email to info@beyondclean.net. If you want your question to be featured on a Mailbag Series video, make sure you type mailbag into the subject line of your email or into the body of the direct message on the social media platform. With all that said, let's get to this episode of Beyond Clean Mailbag. Hey there, Sterile Processing Universe. It's time for another mailbag question. This question today is, what do you do with an implant that comes in unsterile? Hank, I'm going to kick this one to you.
Yeah, so if you're doing any kind of implant procedures like orthopedics, like neuro, you're going to see this happen quite a lot. And the big challenge, I'll kind of start with the person challenge. The person challenge is oftentimes these implants come in with the rep. And so you may not have control over that person the way that you do over your own staff in terms of, when they show up, for instance. So it's very important, no matter what we say the rest of this answer, that you have a policy in place, not only for your department on how to handle this topic, but also for these reps that's built into their vendor credentialing system that says, hey, they don't even start working in our department until they understand what is the workflow for these non-sterile implants when they come into sterile processing. In my opinion, I do think that you need to build a policy, and I think the policy needs to say that we treat these the same way that we treat any other instrument that's coming in from the outside. It's not sterile. And the caveat there is there are some facilities, I know there's a lot of VA hospitals that do this, that have agreements with other hospitals that can share sterile supplies sometimes. So that's an exception to allowing outside instruments coming in. But even that is a contractual agreement, there's a policy around it, and those instruments are coming in sterile. But what we're talking about here is instrumentation implants that are coming in that are not sterilized, and oftentimes they're being short-circuited to the clean side, and that's where you'll bust up in there and there'll be a rep who's like putting all the little screws in the caddy and then sitting it up and say, yeah, this is ready to wrap. And when in reality, we don't have any documentation at all of how those items were cleaned, if they were cleaned and decontaminated, and that's where the real risk is, and that's why I think you need to build a policy around it that says it starts back at square one.
Mm-hmm. Yeah, and you bring up a good kind of corollary to that, which is the new instruments that are coming in fresh out of the package. They're coming from the manufacturer. And, Amy does speak to new instruments, and it's probably going to be up to your facility as to how far you want to take, this standard, but it's in 522, where it says, when indicated, new instruments should be pre-treated according to manufacturer's written IFUs. So there's still a little bit of vagueness there, but it does explain in the rationale that anti-corrosive agents such as oils and greases might have been left on the device by the manufacturer to protect it during shipping, and such agents could interfere with the sterilization process if they are not removed. And, I've had these conversations with a couple of reps in the past before, and kind of the way that they assured us that everything was clean and ready to go. They basically said, this is coming from us already ready to be put into a set. It's already been set up in a way that facilitates that. And I mean, that's nice, but at the time, you're really just taking that particular sales rep's word for it. You don't have any sort of documentation for that. You don't have any sort of verification as to, what that actually entails. Do you know what that manufacturer's shipping process is? Probably not. I don't. And so you're kind of taking a risk. And so I know that it is a little bit more work to say, okay, these have to come out of the package and then go through decontam, and then they have to go into the sets. But that is the safest option unless you have some form of documentation about what it goes through prior to that.
And I think another thing to add to the conversation is the fact that we know these implants are single use. And there's a little bit of controversy as to whether or not they should really be included in a sterile or a tray that's going to be reprocessed multiple times. And it kind of goes back to some conversations we've had on the podcast with Terry McCauley and with Dr. Agarwal, and even Dr. Agarwal presented on this very topic in the recent biofilm conference we put out in July of 2020. So I think there's a lot that we as an industry need to really consider when we're thinking about implants and them being perhaps brought in a sterile package and not even included in a sterile tray.
Yeah, that's a good point. If you're not familiar with Dr. Agarwal Study, that's some pretty scary stuff. You know, he's talking about sterilized screws that have gone through multiple reprocessing. They're not leaving the caddy. They're just taking that round trip through the OR and back again and again and again and again. But by the time that that screw is actually used in the operating room for a particular patient, there's all kinds of debris and damage to those screws. And so his argument is, you know, to what you said, Lisa, it is that we need to be moving away from reprocessing screws at all, and those should come single-use, pre-sterilized, that you open up in the operating room, then end of story. And frankly, for anyone who has ever spilled a caddy of screws and plates, I think that's sterile processing dream right there, that we don't have to mess with these things anymore. I don't think we're quite there yet in the industry, but you know, his data and his research is pretty convincing.
Yeah, and on that research piece that he talked about, Lisa brought up the biofilm conference. You know, one of the points that he made was that infections that are related to these screws sometimes don't show up for months after the procedure. And so, yes, this is like an ultimate nightmare when it comes to, you know, surgical site infections, especially when you consider that because it's happening so long afterwards, it's probably not even getting reported or documented. So, yeah, like the whole reprocessed implant question is a pretty thorny one, especially when we start considering what we're uncovering from a patient safety perspective.
So I'll try to stick onto the subject because I'm a little freaked out of implants that have been in trays for a long time. But yeah, in my sterile processing, we always treated it as it's a new instrument. So we don't want any residuals from the manufacturing process, oils, anything on it. So we would take those and wash them before we actually put them in the trays. And it's the same concept for your backup wall. So I'm just throwing it out there. If you have a backup wall of instruments that are collecting dust, you should be treating those the exact same way. You shouldn't take them directly from the wall and put them in your tray. They should go back through your decontam, get a good cleaning, thermal disinfection before you put them in that tray. So that's what we did, and it worked great. And I'm going to have to think about that long-term implants inside the tray, because it doesn't sound like a good idea.
You know, you're kind of opening up a different box, maybe a different rabbit trail that we're starting to run down. But I feel it's necessary to say that, you know, as sterile processing, you know, we need to understand that the risks to patients are not exclusive to bioburden, right? Obviously, bioburden is the one that gets the most attention for very good reason, but there are other things that can cause complications as well. Things like dust, things like lint, things like oils or excess enzymatic residues. Anything like that can have an adverse outcome, and we need to be as guarded against those things as we are against bioburden. So yeah, great point about the backup wall.
Here at Beyond Clean, we are privileged to bring you excellent sterile processing content every single week. If you're new to the channel, please hit that subscribe button so you don't miss a future video, and hit that like button to let us know you appreciate the content. If you've thought of that question you want to send our way, here's the ways you can hit us up. Thanks for watching and spending time with us, and we'll catch you in the next video.